And as we await news on the vaccine, coronavirus cases unfortunately continue to soar. Yesterday was the second highest daily total since the pandemic began. Our lead national correspondent, David Begnaud, is in Santa Monica, California for us this morning. David, good morning to you. What's the situation there in LA County?
Well, look, consider this analogy. If the vaccine is the fire hose and the fire department is coming, the forest is burning. And the virus is the forest burning. The virus is raging now more than ever. Consider here in LA County. This is the most populated county in the nation. COVID hospitalizations over the course of the last month have quadrupled. The post-Thanksgiving surge of coronavirus is here. It is on us, and it is pushing cases to unimaginable highs. In Los Angeles County, the overwhelming loss of life brought Public Health Director Barbara Ferrer to tears.
The more terrible truth is that over 8,000 people who were beloved members of their families are not coming back.
Nationwide, COVID hospitalizations are at their highest levels ever, up nearly 80% in just the last month. This is Providence St. Mary in Apple Valley, California. There's a tent set up outside to triage those COVID patients arriving, and the lobby is now an inpatient COVID unit because they've run out of room.
I know today that we have 60 patients holding in our emergency department that are waiting for beds inside the hospital. Some of them have been there as long as 7 days.
Consider the healthcare workers who've been going nonstop for months and are getting sick. At the University of Kansas Health System, there are more than 150 staff members who are out after testing positive for the virus, and they've got another 121 who are out because they're awaiting test results. At this Minneapolis hospital, COVID patients are now being treated in rooms that are usually reserved for pediatric patients.
It's very hard, and it's our reality right now. Like, we are holding people's hands on their last breaths every day.
And then there's the work of Father Michael Lewis, a Roman Catholic priest in El Paso, Texas, which has been overwhelmed recently with coronavirus hospitalizations. He is so busy giving last rites to COVID patients who are dying almost on a daily basis that his bishop recently told him, it is your full-time job. How many of your calls to give last rites involve COVID patients?
Right now, almost all of them. I realize that I'm the last person that's going to see this person alive, that they're alone in that room. And as much as I would like to stay there and be with them as they breathe their last, I can't because there are other patients to see.
You know, Father Mike told us many times patients, families will say to him, can I have a picture? I want to see that you gave them the last rites. And I said, well, is it because they don't believe you? And he said, no, not necessarily. Sometimes it's because those left to do the living simply want the tangible proof to look at as a peace of mind that their loved one was given the last rites in their final moment. Anthony?
Yeah, just some comfort, David, that's all. Thank you very much.